NCLEX-RN Practice Exam 1. Question 1. The physician has ordered Stadol butorphanol for a post-operative client. The nurse knows that the medication is having its intended effect if the client A. is asleep 30 minutes after the injection. B. asks for extra servings on his meal tray. C. has an increased urinary output. D. states that he is feeling less nauseated. Answer is correct. Stadol reduces the perception of pain, which allows the post-operative client to rest. Answers B and C are not affected by the medication, therefore, they are incorrect. Relief of pain generally results in less nausea, but it is not the intended effect of the medication, therefore, answer D is incorrect. Question 2. The mother of a child with cystic fibrosis tells the nurse that her child makes snoring sounds when breathing. The nurse is aware that many children with cystic fibrosis have A. choanatresia, B. nasal polyps, C. septal deviations, D. enlarged adenoids. Answer B is correct. Children with cystic fibrosis are susceptible to chronic sinusitis and nasal polyps, which might require surgical removal. Answer is incorrect because it is a congenital condition in which there is a bony obstruction between the nares and the pharynx. Answers C and D are not specific to the child with cystic fibrosis, therefore, they are incorrect. Question 3. A client is hospitalized with hepatitis A. Which of the client's regular medications is contraindicated due to the current illness? A. praloxicomeprazole, B. synthroid levothyroxine, C. premarin conjugated estrogens, D. lipid-lowering. Answer D is correct. Lipid-lowering agents are contraindicated in the client with active liver disease. Answers A, B, and C are incorrect because they are not contraindicated in the client with active liver disease. Question 4. The nurse has been teaching the role of diet in regulating blood pressure to a client with hypertension. Which meal selection indicates that the client understands his new diet? A. cornflakes, whole milk, banana, and coffee. B. scrambled eggs, bacon, toast, and coffee. C. oatmeal, apple juice, dry toast, and coffee. D. pancakes, ham, tomato juice, and coffee. Answer C is correct. Oatmeal is low in sodium and high in fiber. Limiting sodium intake and increasing fiber helps to lower cholesterol levels, which reduce blood pressure. Answer is incorrect because cornflakes and whole milk are higher in sodium and are poor sources of fiber. Answers B and D are incorrect because they contain animal proteins that are high in both cholesterol and sodium. Question 5. An 18-month-old is being discharged following hypospadias repair. Which instruction should be included in the nurse's discharge teaching? A. The child should not play on his rocking horse. B. Applying warm compresses to decrease pain. C. Diapering should be avoided for 1 to 2 weeks. D. The child will need a special diet to promote healing. Answer is correct. The child will need to avoid straddle toys, swimming, and rough play until allowed by the surgeon. Answers B, C, and D do not relate to the post-operative care of the child with hyperspadias, therefore, they are incorrect. Question 6. An obstetrical client calls the clinic with complaints of morning sickness. The nurse should tell the client to A. Keep crackers at the bedside for eating before she arises. B. Drink a glass of whole milk before going to sleep at night. C. Skip breakfast but eat a larger lunch and dinner. D. Drink a glass of orange juice after adding a couple of teaspoons of sugar. Answer is correct. Eating a carbohydrate source such as dry crackers or toast before arising helps alleviate symptoms of morning sickness. Answer B is incorrect because the additional fat might increase the client's nausea. Answer C is incorrect because the client does not need to skip meals. Answer D is the treatment of hypoglycemia, not morning sickness, therefore, it is incorrect. Question 7. The nurse has taken the blood pressure of a client hospitalized with methicillin-resistant Staphylococcus aureus. Which action by the nurse indicates an understanding regarding the care of clients with MRSA? A. The nurse leaves the stethoscope in the client's room for future use. B. The nurse cleans the stethoscope with alcohol and returns it to the exam room. C. The nurse uses the stethoscope to assess the blood pressure of other assigned clients. D. The nurse cleans the stethoscope with water, dries it, and returns it to the nurse's station. Answer is correct. The stethoscope should be left in the client's room for future use. The stethoscope should not be returned to the exam room or the nurse's station, therefore, answers B and D are incorrect. The stethoscope should not be used to assess other clients, therefore, answer C is incorrect. Question 8. The physician has discussed the need for medication with the parents of an infant with congenital hypothyroidism. The nurse can reinforce the physician's teaching by telling the parents that A. The medication will be needed only during times of rapid growth. B. The medication will be needed throughout the child's lifetime. C. The medication schedule can be arranged to allow for drug holidays. D. The medication is given one time daily every other day. Answer B is correct. The medication will be needed throughout the child's lifetime. Answers A, C, and D contain inaccurate statements, therefore, they are incorrect. Question 9. A client with diabetes mellitus has a prescription for Glucotrol XL glipizide. The client should be instructed to take the medication A. At bedtime. B. With breakfast. C. Before lunch. D. After dinner. Answer B is correct. Glucotrol XL is given once a day with breakfast. Answer is incorrect because the client would develop hypoglycemia while sleeping. Answers C and D are incorrect because the client would develop hypoglycemia later in the day or evening. Question 10. The nurse is caring for a client admitted with suspected myasthenia gravis. Which finding is usually associated with a diagnosis of myasthenia gravis? A. Visual disturbances, including diplopia. B. Ascending paralysis and loss of motor function. C. cogwheel rigidity and loss of coordination. D. Progressive weakness that is worse at the day's end. Answer D is correct. The client with myasthenia develops progressive weakness that worsens during the day. Answer is incorrect because it refers to symptoms of multiple sclerosis. Answer B is incorrect because it refers to symptoms of Guillain Barre syndrome. Answer C is incorrect because it refers to Parkinson's disease. Question 11. The nurse is teaching the parents of a newborn with osteogenesis imperfecta. The nurse should tell the parents A. That the baby will need daily calcium supplements. B. To lift the baby by the buttocks when diapering. C. That the condition is a temporary one. D. That only the bones are affected by the disease. Answer B is correct. To prevent fractures, the parents should lift the baby by the buttocks rather than the ankles when diapering. Answer is incorrect because children with osteogenesis imperfecta have normal calcium and phosphorus levels. Answer C is incorrect because the condition is not temporary. Answer D is incorrect because the teeth and the sclera are also affected. Question 12. Physician's orders for a client with acute pancreatitis include the following: strict NPO, NG tube to low intermittent suction. The nurse recognizes that these interventions will A. Reduce the secretion of pancreatic enzymes. B. Decrease the client's need for insulin. C. Prevent secretion of gastric acid. D. Eliminate the need for analgesia. Answer is correct. Placing the client on strict NPO status will stop the inflammatory process by reducing the secretion of pancreatic enzymes. The use of low intermittent suction prevents release of secretion in the duodenum. Answer B is incorrect because the client requires exogenous insulin. Answer C is incorrect because it does not prevent the secretion of gastric acid. Answer D is incorrect because it does not eliminate the need for analgesia. Question 13. A client with a diverticulitis is admitted with nausea, vomiting, and dehydration. Which finding suggests a complication of diverticulitis? A. Pain in the left lower quadrant. B. Board-like abdomen. C. Low-grade fever. D. Abdominal distension. Answer B is correct. A rigid or board-like abdomen is suggestive of peritonitis, which is a complication of diverticulitis. Answers A, C, and D are common findings in diverticulitis, therefore, they are incorrect. Question 14. The diagnostic workup of a client hospitalized with complaints of progressive weakness and fatigue confirms a diagnosis of myasthenia gravis. The medication used to treat myasthenia gravis is A. Prostigmine neostigmine. B. Atropine sulfate. C. Didronletidronate. D. Tensilomnedrophonium. Answer is correct. Protigmine is used to treat clients with myasthenia gravis. Answer B is incorrect because it is used to reverse the effects of neostigmine. Answer C is incorrect because the drug is unrelated to the treatment of myasthenia gravis. Answer D is incorrect because it is the test for myasthenia gravis. Question 15. A client with AIDS complains of a weight loss of 20 pounds in the past month. Which diet is suggested for the client with AIDS? A. High calorie, high protein, high fat. B. High calorie, high carbohydrate, low protein. C. High calorie, low carbohydrate, high fat. D. High calorie, high protein, low fat. Answer D is correct. The suggested diet for the client with AIDS is one that is high calorie, high protein, and low fat. Clients with AIDS have a reduced tolerance to fat because of the disease as well as side effects from some antiviral medications. Therefore, answers A and C are incorrect. Answer B is incorrect because the client needs a high-protein diet. Question 16. The nurse is caring for a 4-year-old with cerebral palsy. Which nursing intervention will help ready the child for rehabilitative services? A. Patching one of the eyes to strengthen the muscles. B. Providing suckers and pinwheels to help strengthen tongue movement. C. Providing musical tapes to provide auditory training. D. Encouraging play with a video game to improve muscle coordination. Answer B is correct. The nurse can help ready the child with cerebral palsy for speech therapy by providing activities that help the child develop tongue control. Most children with cerebral palsy have visual and auditory difficulties that require glasses or hearing devices rather than rehabilitative training. Therefore, answers A and C are incorrect. Answer D is incorrect because video games are not appropriate for the age or developmental level of the child with cerebral palsy. Question 17. At the 6-week checkup, the mother asks when she can expect the baby to sleep all night. The nurse should tell the mother that most infants begin to sleep all night by age A. 1 month. B. 2 months. C. 3 to 4 months. D. 5 to 6 months. Answer C is correct. Most infants begin nocturnal sleep lasting 9 to 11 hours by 3 to 4 months of age. Answers wing B are incorrect because the infant is still waking for nighttime feedings. Answer D is incorrect because it does not answer the question. Question 18. Which of the following pediatric clients is at greatest risk for latex allergy? A. The child with a Miller-Mening-O cell. B. The child with epispardias. C. The child with coxaplanar. D. The child with rheumatic fever. Answer is correct. The child with Miller-Mening-O cell is at greatest risk for the development of latex allergy because of repeated exposure to latex products during surgery and from numerous urinary catheterizations. Answers B, C, and D are much less likely to be exposed to latex. Therefore, they are incorrect. Question 19. The nurse is teaching the mother of a child with cystic fibrosis how to do postural drainage. The nurse should tell the mother to A. Use the heel of her hand during percussion. B. Change the child's position every 20 minutes. C. Do percussion after the child eats and at bedtime. D. Use cupped hands during percussion. Answer D is correct. The nurse or parent should use a cupped hand when performing chest percussion. Answer is incorrect because the hand should be cupped. Answer B is incorrect because the child's position should be changed every 5 to 10 minutes and the whole session should be limited to 20 minutes. Answer C is incorrect because chest percussion should be done before meals. Question 20. The nurse calculates the amount of an antibiotic for injection to be given to an infant. The amount of medication to be administered is 1.25 milliliters. The nurse should A. Divide the amount into 2 injections and administer in each vastus lateralis muscle. B. Give the medication in 1 injection in the dorsogluteal muscle. C. Divide the amount in 2 injections and give 1 in the retrogluteal muscle and 1 in the vastus lateralis muscle. D. Give the medication in 1 injection in the retrogluteal muscle. Answer is correct. No more than 1 milliliter should be given in the vastus lateralis of the infant. Answers B, C, and D are incorrect because the dorsogluteal and ventrogluteal muscles are not used for injections in the infant. Question 21. A client with schizophrenia is receiving depot injections of Haldol Deconate haloperidol 08. The client should be told to return for his next injection in A. 1 week, B. 2 weeks, C. 4 weeks, D. 6 weeks. Answer C is correct. Depot injections of Haldol are administered every 4 weeks. Answers 1 B are incorrect because the medication is still in the client's system. Answer D is incorrect because the medication has been eliminated from the client's system, which allows the symptoms of schizophrenia to return. Question 22. EH 3-year-old is immobilized in a hip spica cast. Which discharge instruction should be given to the parents? A. Keep the bed flat, with a small pillow beneath the cast. B. Provide crayons and a coloring book for play activity. C. Increase her intake of high-calorie foods for healing. D. Tuck a disposable diaper beneath the cast at the perineal opening. Answer D is correct. Tucking a disposable diaper at the perineal opening will help prevent soiling of the cast by urine and stool. Answer is incorrect because the head of the bed should be elevated. Answer B is incorrect because the child can place the crayons beneath the cast, causing pressure areas to develop. Answer C is incorrect because the child does not need high-calorie foods that would cause weight gain while she is immobilized by the cast. Question 23. The nurse is caring for a client following the re-implantation of the thumb and index finger. Which finding should be reported to the physician immediately? A. Temperature of 100 degrees Fahrenheit. B. Coolness, discoloration of the digits. C. Complaints of pain. D. Difficulty moving the digits. Answer B is correct. Coolness and discoloration of the re-implanted digits indicates compromised circulation, which should be reported immediately to the physician. The temperature should be monitored, but the client would receive antibiotics to prevent infection. Therefore, answer A is incorrect. Answers C and D are expected following amputation and re-implantation. Therefore, they are incorrect. Question 24. When assessing the urinary output of a client who has had extracorporeal lithotripsy, the nurse can expect to find A. cherry red urine that gradually becomes clearer. B. Orange tinged urine containing particles of calculi. C. Dark red urine that becomes cloudy in appearance. D. Dark, smoky colored urine with high specific gravity. Answer is correct. Following extracorporeal lithotripsy, the urine will appear cherry red in color but will gradually change to clear urine. Answer B is incorrect because the urine will be red, not orange. Answer C is incorrect because the urine will not be dark red or cloudy in appearance. Answer D is incorrect because it describes the urinary output of the client with acute glomerulonephritis. Question 25. The physician has prescribed Cognex Tacrine for a client with dementia. The nurse should monitor the client for adverse reactions, which include A. Hypoglycemia, B. Jaundice, C. Urinary retention, D. Tinnitus. Answer B is correct. An adverse reaction to Cognex is drug-induced hepatitis. The nurse should monitor the client for signs of jaundice. Answers A, C, and D are incorrect because they are not associated with the use of Cognex.
Thanks for watching. Please comment, like and share.